Hey guys, welcome back to another episode of Divas Who Listen. My name is Miranda.
And I'm Bella.
And we're going to read a couple stories and then Bella's going to share one of hers as well today.
I just want to say that we're very excited to continue on with this show. So please submit any stories that you have. They don't have to be negative, they can be happy. Just anything that kind of elicited some kind of emotion or feeling for you in the medical experience. We want to share it all. You don't have to have VEDS. So let's, get the word out there with some of these stories. And then you can listen to us anywhere, YouTube, Apple Podcasts, and Spotify now. So
We're fancy with it now.
we're going to be Mrs. Worldwide's.
We love Pitbull. Can you imagine? Pitbull should come on our show.
Agree.
This is our official plea to Pitbull. Hashtag get Pitbull on Divas Who Listen 2024 challenge.
He's our favorite diva.
So let me read the first one. It's a little long, so bear with me, everybody. But that's good because we want more details so we can react to. It says here, I'm 29 years old and I was born with bilateral clubfoot, meaning I have a clubfoot on both feet. I was born with a severe case, so I've experienced manipulation, casting, 10 surgeries, wow, and years of on and off physical therapy. My last major surgery was in 2017, so in 2020, pre-COVID, I thought it would be beneficial to see my orthopedic specialist to check on my condition. My feet tend to relapse easily, so I wanted to be proactive. Well, I got to my PCP for an authorization to see my specialist, and after 7 years of having this doctor as my PCP, she asked why I needed to see an orthopedic specialist. I was confused, but I understand she has plenty of patience. I reminded her that I have bilateral clubfoot. Then she proceeds to have me take off my shoes and socks, which she says is common with specialists but not anywhere else. I follow her request and she quickly proceeds to tell me that I don't have clubfoot. What?
And this is a doctor she's seen for 7 years?
I know. I feel like even a doctor that I've seen once remembers, like, hey, weren't you here like 2 weeks ago?
Yes. And if it's a primary care doctor too, like, why not ask more about the concerns than just immediately being like, well, you don't have this.
Yeah. I feel like sometimes doctors are so quick to, like, jump on something. One time I called and told an eye doctor that I had astigmatism, and then right away they're like, well, how do you know? Did you go to a doctor? I was like, I literally went to a doctor. I'm just telling you because you're a new doctor to me. Like, yeah. But this is so much bigger. It's something that she's lived with her entire life. And
exactly.
Like, I don't know. I feel like the way that she went about it.
Right. And, like, while I appreciate that, a doctor wants to confirm that somebody has the diagnosis they're talking about, this is somebody that you've been seeing.
Yeah.
And, like, it's clearly, I'm sure it's in her chart that she's had all these, the histories of surgeries and everything. Like, I don't know how the doctor could be completely blindsided by this diagnosis. And then to look at the foot, like, I'm sure she probably sees the surgical scars on the foot. Like, how can you look at it and be like, no, I can't imagine. Actually, and that happened to me when I went to see a neurologist. I had moved to my new city and I was establishing care with a new neurologist, just because, with VEDS, the way that my mom had kind of ordered my care when I was a child is that just establish care with all these specialists for things that we're at risk for. That way they already know my medical history and they get to know me, right? And so I was like, I'm going to go see a neurologist just in case, I have problems with my arteries and the neck and the head down the line. And I told her that I have von Willebrand's, which is a bleeding disorder, and VEDS. And I even gave her my long history note that my hematologist provided me about all my history with von Willebrand's and VEDS for 20 years before I moved to the city. And she was going through it and was like, well, how did you get diagnosed with von Willebrand's? And I was like, well, my hematologist diagnosed me. I was like, the labs from literally 1999 were in line 1 of the paper that I gave her. And then she was like, how did you get diagnosed with VEDS? And I was like, well, I got genetic testing done. Like, I have this mutation in the collagen 3 gene. And then she was like, well, I just want to make sure because we don't want to treat you for something we don't have. And I was just like, what the hell is this lady on?
know.
And then so finally she's flipping through the paperwork. She's like, oh yeah. She was like, I see that you had the blood labs like consistent with von Willebrand's. And I was like,
I know.
I literally told you it's in the paperwork.
Yeah.
I handed you the paperwork.
It's like, why do they assume that we're just making this up?
Exactly. For what?
Yes, especially things that are so debilitating like that. It's like, I wouldn't just make this up and go to all these doctors to establish care. Like, that's taking time and money.
Yes.
From myself every time I want to go. Let me read the second half. So the doctor said that she doesn't have clubfoot after looking at both of her feet. And then she says I have something else. And I was so shocked that I didn't even pay attention to the name. I remember Googling on the spot and told her, no, I don't have that. I was born with clubfoot, and I have been treated by numerous orthopedic specialists and surgeons for that exact diagnosis. She shrugged it off and said, I'll give you the authorization anyway. Her tone made it sound like, sure, whatever makes you feel better. I couldn't believe it. Because so many doctors commonly dismiss your diagnosis, my mom always made it a point to request paper and digital copies of my surgical reports. You do that too, right?
Yeah.
Yeah. I remember I gave copies to this doctor's office after my last surgery, so I encouraged her to look it up. Her nurse did, and ta-da, there was proof of my diagnosis. Once again, she didn't admit she was wrong or seem impressed. She just said, okay, I'll give you the authorization. She sounded skeptical and wasn't interested to learn about my condition. Now, she typically gives me authorization and answer my requests and questions without questioning me back. This is a reminder to always advocate for yourself and keep your own medical records to share with your medical team. That sounds like such like a job as well. To keep up with the records. Like even doing it digitally and paper form.
I always say that managing a chronic illness like VEDS is a full-time job because having to keep on top of all the records, and you are the one not only educating doctors about your diagnosis, but you're also providing them with your history and basically like your medical resume, So if they only know what you tell them, and even if you tell them, like, they want to see the diagnosis most of the time. Yeah, some are a little bit more compassionate than others, and they can just tell by talking to you that you have actually had that history. But it's a lot of work, especially for something that should already be in the chart. Like, come on.
Yes. I can understand wanting to like confirm and seeing like what your care history has been. I appreciate that. But if I have gone out of my way as a patient to send you the paperwork and asked you to research something, then maybe take like the 2 minutes before you come into the room to do so,
Yeah. And the gaslighting was...
Yeah, that's what I was about to say.
Unreal in that scenario.
I can't believe that it was her primary care, like her established primary care.
Yeah.
What did she say after 7 years of seeing her? I mean, doctors have a lot of patience, but she went prepared.
Exactly. And like you said, it's just the way that the doctor handles things. Like, there's a way to go about it. If you really don't believe that your patient has this diagnosis, you could ask more questions about, what procedures did they have done or how has it been treated? Because some patients don't know, the names of things that they've had done,
right,
or the diagnosis. So the way to go about that is to be like, who diagnosed you? How did you get diagnosed? How has it been treated? What specialists have you seen before? Try to get more info that way instead of just being like, no.
And you know what I will say is exactly what you said, that sometimes you don't know. I hardly know the 2 medications I'm on, They'll be like, what's the name? And I'm like, let me Google this really quick. So people taking that initiative, making sure they know their stuff, making sure they know their doctors, and they have that paperwork, like that has inspired me to be a little bit better about that, because everybody's time is precious on both sides.
And it sucks because as a patient, you have to make yourself credible.
Yeah.
You know what I mean? Like, it's you have to build yourself up just for a medical professional to listen to you. Growing up, my mom had to fight for people to listen to her. But with me, since I have my nursing education, I've noticed that a lot more medical professionals really take the time to hear me out or understand my concerns and everything. Like, it's just sad that patients have to do that when they're probably very lost and confused and are trusting in this medical professional to guide them and navigate them and listen to them and all of that.
Yeah, you're in like a vulnerable position already.
Exactly. Yeah, like people get high blood pressure readings at the doctor just for being there because it's anxiety inducing.
Yeah, it can be for sure.
It's a good story. Hi, divas. My medical roller coaster began when I was 18. My amazing aunt recognized early on that my irregular periods and my excruciating cramps might actually be much more serious. She had this knowledge because she dealt with undiagnosed PCOS all her life and didn't gain knowledge or assistance till her 30s when she was trying to get pregnant. So PCOS is polycystic ovarian syndrome.
Yes.
Okay, so the aunt didn't know until her 30s when she was trying to get pregnant. Upon seeing my first nurse practitioner with a gynecology office, I was told, in quotation marks, "You don't have PCOS, you aren't obese, you do not have hirsutism, which is irregular hair growth, and you don't have acne." So that was what the practitioner said. This is the reason why she doesn't have PCOS. Thankfully, my aunt was my advocate and said those symptoms aren't everyone's. She needs an ultrasound and blood work immediately. Well, lo and behold, there it was, the string of pearls, how they lovingly call the cysts that line your ovary, and the blood work showed I most definitely was a PCOS girly. Thankfully, I was given a game plan to start metformin to help with the insulin resistance and birth control to regulate my periods. What if her aunt wasn't there?
I know. And what if her aunt didn't have PCOS as well? Like, she wouldn't have even known. She was 18 years old.
Especially that young, I would have been like, oh, okay.
A
like,
child.
Thank you.
Yes. One thing that stuck out to me when you were reading their story is that after they got, was it their blood work done?
The blood work and an ultrasound?
I think, no, but they didn't even do that. That's what stuck out to me. They didn't do blood work. They didn't do an ultrasound, yet they told her you don't have this.
Oh, yeah. Based on the clinical features.
Based on,
alone.
yes, exactly. And that to me is like red flag. Because I'm telling you, something is up, but you're not taking all the extra steps to get there.
Right.
And so I can relate super big on this because I didn't get diagnosed with PCOS until this year, actually. And I wouldn't have known. And my doctor is an angel. She asked me what I wanted to do, when I could do the ultrasounds, the blood works, all that. So it was like the opposite experience. But that was the first thing she did, is ask me when I could do both of those things. But how would she have known? Because I don't know what the medical term is, but they said that she didn't have like excessive hair growth. And they also said that she didn't have something else. What was it? Oh, the acne. I don't have that either. But you can't go off of because I don't have this problem and this problem, that I'm not experiencing the other symptoms. You know, like you have to go through all the correct channels to try to see what is happening with your patient if they're telling you something is wrong.
And I can understand from like an insurance point of view, maybe they don't have the features, so maybe they're worried about getting coverage for, the lab work or the ultrasound. But I think with, maybe a family history like she had, and even so, I don't know, because looking at it from the medical perspective too, it's like, well, what presented her to the clinic to question this, right? But it doesn't, like we say throughout this whole thing, it doesn't hurt to take the time to sit down and listen to why the patient is concerned for this diagnosis. And then also have the discussion of like, well, it's not likely because you don't have this, and this feature. But if you want, like, we could still test you or something, or even just start with blood work.
Yes.
Like, if you don't want to do the ultrasound, at least start with that. But it's just wild to me that, what if she would have gone so long, many years without getting a diagnosis because that one time the doctor was like, you don't have it. And then she lives her life being like, I don't have it. What's wrong with me?
Exactly.
Right?
Exactly. Because it can present itself in so many ways.
I'm going to line it a lot up to the VEDS journey, I guess, if you will, a VEDS storyline, because, you know, my main theme is VEDS. That's what I raise awareness for. Well, I want to raise awareness for everything in the healthcare field, but with VEDS, that's another thing, is that doctors will say, like, oh, well, you don't have the thin skin, or you don't have the visible veins, which are very strong features of VEDS, but they don't have to be present for you to have the diagnosis of VEDS. Like, the confirmation is the genetic test. So how do you get the testing if you don't have the features, right? So it's really important to really just sit down with the patient and go through everything. It's all a puzzle. You have to go through all the little pieces of the puzzle to try to put it together. That way you can get treated.
Yes.
And if you don't have it, then you don't have it. But at least you ruled it out. There are so many conditions that are diagnosed because of ruling out other conditions. Going through all that process, right? So.
And I think, like, with VEDS, you have to go through all the ways of testing for it, or seeing what the different symptoms that can present themselves are.
Yeah.
Because, I mean, I'm pretty sure you have told me, like, people have died because they were undiagnosed, or because people didn't believe them.
Yep.
And it can happen like that. It's scary.
And even in my case, if I hadn't gotten diagnosed, who knows what would have happened with my first event when I was 18. Like, my mom doesn't think I would have made it, because they would have sent me home when I needed emergency surgery.
Yeah.
But they wouldn't have done the right scans on me, because I was just like a normal, healthy 18-year-old. They would have just sent me home. Whereas, like, my mom knew that I had features that were different compared to her other children, and she pushed for me to get tested for something. And not everybody has an advocate that can do that, like my mom and this aunt here, you know? It's scary.
It is.
So the rest of her message, or her story, says, fast forward to a point in my life where I was married and wanting to start a family. I assumed a fertility specialist would have a kind of way of speaking to me after multiple blood draws, an invasive and painful transvaginal ultrasound that involved dye being shot up into me to capture images of my ovaries and uterus, but I was mistaken. He said to me after months, well, you're a tough case. Defeat and sadness came over me. Though this was over 8 years ago and I'm now divorced and in a happy relationship, I've carried that lack of bedside manner with me. I'm grateful for all I've learned, and I do my best to advocate for all my fellow ladies, especially my fellow sisters. Oh, that's cute. Like CYSTER. Yeah. Sisters. Thanks for hearing me out, divas. Wow. So the fertility specialist just literally shot her down.
That's hard. Oh my God. Going to a fertility specialist. Yes, exactly. That's heartbreaking, because you already feel like a type of way because you're being shut down by doctors, and you're probably feeling extra vulnerable. And then to go to a fertility specialist, like, that's probably the most scary thing you can do when you already know that it's going to be a long road to getting pregnant and all that. That would be scary. That'd be sad. You know?
And being called a tough case when you're already feeling that way, just kind of like, like, what are we going to do about it then, you know? What can we do about it?
So
what
give me options.
Yeah. I was actually I've been reading a lot about patient advocacy for work, and there was an article that was explaining that doctors should outline treatment plans that even include no treatment. Like, these are your options. You could take this medicine, you could have no treatment, you could have this, and the rationale behind everything, pros and cons. And that was giving a better response in patients, like feeling more satisfied with their doctor and being more in charge of their healthcare compared to like other ones where they were just like, well, here's a treatment, take it, you know?
That's interesting.
It is interesting. I don't know if they learn like these kind of skills in school itself, or if it's something that they acquire in the actual like clinical setting. Because it's really interesting how medical providers are just on such a huge spectrum of like what you're gonna get. And I'll even say that I've had doctors that I was like, ew, I don't like you right at the beginning of the visit, but then they turned around like at the end of the visit and they have become one of my favorite doctors.
Yeah. I feel like it always happens like that.
It does.
It's like, I'm not sure of your vibe, but then by the end,
Besties.
yeah.
Yes. We're stuck for life now.
Yes.
Even when I was a child, my pediatrician, he was always available because so many parents didn't like him because he was very like short and quick. But honestly, he was so concise.
Yeah.
Like he was very thorough, and his bedside manner, it wasn't cheery or anything, but it was just like we loved
He
him.
got to the point.
Yeah.
I mean, I like that.
And I always remember he'd always be like, well, I'm not saying she has strep, but we're going to test her. Like, I'm not saying. That was always his line.
I love that.
Yeah.
One of my doctors, actually my orthopedic surgeon, he says I never listen to him. Because he'll be like, all right, Miranda, what did you do? I'll be like, well, you know what? Yesterday I took Tylenol and I did this. And, like, I'll start going off about something else. And he's like, okay, Miranda, come back to the question and tell me what you did to her to help your leg. I'm like, oh, okay, sorry. He's like, I'm glad you had a good day at work. And but answer the question.
Just come back down, please. And that's like whenever I go to my current PCP, because you know I go for injuries or whatever to get treated. He always walks in the door shaking his head at me. He's just like, like I'm sorry.
They already know. You already know what's up.
So I would definitely tell people to doctor shop. If you have a doctor that's just an ass or does not listen to you, they might not have the best side manner, but if they're a great doctor, you know,
Yeah.
maybe you have to just find what's best for you. And not every doctor is going to be the same. You might like the stories from the last episode that we did where one of the girls or one of these people writers went to 2 different hospitals and they had 2 completely different experiences.
Yes.
So it might be different clinics. You know, it might, what I tend to do is if I find a doctor that I like, I'll ask that doctor to refer me to other doctors because they'll likely refer me to people that are in their circle or that are kind of like them.
They like align with each other.
Yes. So then I'll usually stick with their recommendations or have a little more trust in what they tell me.
And that's what I was going to say. Like, even if you can't doctor shop, because doctor shopping, like, in person, girl, that's going to add up. But yeah. I always, like, ask people that I know might be going through something similar. And then my doctor, too, because I love my PCP. I think, like, their whole clinic is on the same page. And so whoever she recommends me to, I'm like, all right, I'm out. Say less. I don't even question it.
But you definitely have to catch the vibe. Because I remember one time I went to, I don't know if it was a gynecologist. I went to one doctor, maybe for my hip or something. I had to get like a pelvic something, I don't know. And I remember that they referred me to get imaging done, but it had to be at this one specific center. And I found out that I think she was married to like one of the doctors at the center that she was referring to. So sometimes it's kind of like, well, they might just be strictly like business referrals or something. So it depends on the vibe of your doctor.
I didn't
for sure.
think about that.
Yeah. I didn't either. My mom was like, go somewhere else. And then I was like, why? And she was telling me that she probably thinks like they're not in cahoots, but in cahoots. I'm not saying they're in cahoots.
That was good.
Thank you.
Good. Full circle.
Another way that we could find doctors is through support groups. So like if you have a diagnosis, there's a lot of support groups on Facebook, which I mean not all of them are the best. Even Reddit, I've actually found Reddit to be increasingly useful. The more I get older, I guess. But there are different ways where you could ask around and get opinions of doctors based on even just your diagnosis. That could be helpful too, because it would be helpful to see a doctor who really sees a lot of the same diagnosis regularly, because then they kind of become experts in that little area. Yeah. So that is another way of searching for a doctor. It can be overwhelming. And it's hard if you don't have access to like a whole long list of doctors either to be changing around.
It's hard to know. Even like with a Google search, like you'll get a billion people.
Yeah, and then you just close your window immediately.
Yeah. Like,
It's too much.
No, good.
Before we wrap up this episode, I wanted to share one of the experiences that I've had in the emergency room. And this was maybe like 2 or 3 years ago. But I went in for abdominal pain. And it's kind of hazy now. But I remember that there was a emergency room resident that saw me. So I don't know if you know like the hierarchy of doctors, but residents, they have graduated medical school, they're licensed doctors, but they're doing their training to basically become a full doctor on their own. So they work under supervision of an attending doctor who they've completed residency, and they're basically at the head of the hierarchy.
Okay.
And so the residents, they could be anywhere from first year residents I think are interns, and then second to fourth year residents are residents. So that's just basically how it works.
Okay.
So anyways, one of the emergency room medicine residents was taking my history. I don't know where he was in that stage of residency, but he went into the waiting room where my mom and I were, and he was asking me to tell him about my symptoms. So I remember he like crouched below me, or not below me, but next to me. And I was telling him, when the pain started, everything about what was going on. And then I was telling him, that I think I said I had VEDS. And I even mentioned that I had blood in my stool. I wasn't concerned about it, but I know that they were more likely to take that seriously if I said that, because with VEDS, it's likely that I just some like tissue tore in there and it's bleeding a little. I wasn't worried. So anyways, I mentioned that to try to make them actually take me seriously, and he did not even pay attention to that. He assumed I had a different type of Ehlers-Danlos syndrome, not the vascular type. And then he had come back to me, and I had asked him because he was like, okay, we're going to order an abdominal CTA. So basically to look at the arteries in my abdomen to make sure that they're okay. And then I was like, well, and that was going to be with contrast. So they would have to put an IV in my arm and then inject me with contrast so they could see the arteries. So I asked him, I was like, my cardiologist just ordered a chest CTA with contrast. Like, can I get them done
At the same time?
Can you add it? Yeah, that way I don't have to get poked again. I don't have to come back and get contrast again. I was like, it's in my patient portal. Like, I can show you the message right here, the order. And he was like, oh, I'll go check in the system. So he went and he came back and he was like, before he went even to go check, when I asked for the chest CTA, he was like, I don't know if we could do that. And then I was just looking at him and I was like, why? And he was like, well, if we find something, then we're going to have to treat it by adding the chest abdomen to it.
At the hospital.
And I was like, yeah, I'm sorry for making you treat something in the emergency room at the hospital.
Oh, my
And so I was just like staring at him. And then I was like, well, I get these scans every year to 2 years to check for any aneurysms or dissections in my arteries to make sure that everything's okay. And he was like, well, do you have an aneurysm? And I said, no. I said, the point is to find one if I do have one.
Right.
Like, it's just a screening tool that I have to get done. And I was just like, what the hell? So he went. That's when he went to go try to look for the order, and he came back because like, I don't see it. So I showed it to him again, and then they were able to like add it and get it done. But that doesn't even end there. So that was like with the CT part, and then I was put in a room or something, and then I think I was talking to the nurse or another resident or something, and I told them that I had blood in my stool, and I told them my same exact thing that I told that first resident, and he came busting through the door, and he was like, I didn't know you had blood in your stool, like we have to get a sample. And I was just like,
oh my goodness.
I told him, I was like, I told you. I was like, I don't think you heard me, but I told you.
This was the original resident?
Yeah, the one who told me that gave me a hard time about adding the chest CT. Because I guess whoever did the history once I was in a room at the ER, like, talked with him. And then he was like, I didn't know you had blood in your stool. And I was just like, yes, you did.
Yes.
My mom even heard me tell you. I don't know if he was just having, like, a crazy day, but
He very well could have been. But you know what, like, I think is scary to do that you and a lot of these stories have to do is, like, correct the doctor. Like that to me, because like I'm a patient. I don't know what the heck I'm talking about. I can tell you what I'm experiencing, but if you say, oh, it's fine, or if you're like, oh, you know what, we won't have to do that, I'm like, okay, that's fine. I'm gonna believe you. You guys like advocating for yourselves and questioning why or why not. You know what I mean? Like that takes some guts to do.
Yeah.
Because I'm going with the assumption that whatever you're telling me is what we're going to do. I'm like, all right, cool. And to advocate for yourself like that is admirable and brave.
It is. And I think all these stories just highlight the need. No matter where you are on the spectrum of a medical diagnosis, it is just so important to learn what you can about your own diagnosis, because they're not going to teach you. They're too busy. It's on you to the way that we have best learned with the VEDS is by connecting with others. So we'll find out like, oh, this person's gotten through this experience, this is how they were treated, and then we'll bring it up to our doctors or say, well, we know somebody with VEDS went through this, and then like how can we apply it to our situation, and have that discussion with our doctors.
Yeah.
But it sadly is something that you like literally just have to become an expert in yourself.
You have to seek out people who have gone through the same thing and seek
resources.
Yeah, exactly. And thank goodness there are some.
Yeah, and nurses do education. So I know that hospitals have programs for certain diagnoses too. So maybe if you can like sign up for something, that'll be helpful.
There is a lot, actually.
There is, and you don't know that they're out there. Like for my colostomy bags, they have a specific clinic, I think one day of the month or one day of the week or something, where you can go in and they just do a bunch of like colostomy teachings, and they work with you to change your bag and see how you're doing it and stuff. Like they have that resource available.
That's good. People need options like that. Like, because you know what I noticed is that I always see like signs on the freeway for like the weight loss ones, like at the hospitals around here. But when you actually like look into it, there's so many more. There's so many more clinics, is that what they're called? Clinics that you can go to, or like educational classes, I guess.
Yeah.
Even through your insurance. There's a lot. I've learned a lot about insurance.
We could do a whole like season of insurance stories. Maybe we should add that, actually. If you have any insurance stories we could talk about on this.
Oh, that's a good one.
Yeah, I know it's a very hot topic right now with everything going on with, I don't know if you heard that Blue Cross Blue Shield in like 3 states were trying to cap the amount of payment for anesthesia, especially for people like me who have complications during surgery and might have to have prolonged surgery. Excuse me?
Ugh.
I'm asleep. Do you want me to just wake up and be like, please stop, I'm at my limit?
We reached our capacity. Sorry. I'm gonna head out.
We'll continue this next year when my insurance renews.
That is absurd. That would be a good episode.
It would be. And talking about all of this, like, again, that just highlights why I became a nurse. Is even though I was uncertain that I would be able to practice as a nurse, I wanted the education and background to help me as a patient.
Yeah.
So I know what to expect, or what I should be expecting in hospital care, right? Because I know the back end of it. And even like I had a cousin who he was in the hospital, and they were giving him the shots of blood thinner because they're trying to prevent blood clots from you laying in the bed and being at the hospital. Like that's just a standard of care that every hospital does to every admitted patient. And I always say no to that because of Von Willebrand's. Like, I don't need a blood thinner, please. Because that's going to make me think so much worse for me. But I told my cousin, I was like, you can deny that. You can deny the treatment that you're, or refuse. Like, they'll just have to explain to you what it means and the risks if you don't take it.
Right.
But you have that option. And I think that clinics, hospitals, you're not aware of that choice because they present it in the way that's like, here,
this is what we're doing.
Yeah.
I think that's like a common thread in the stories today, including yours, is like ask why not, and then like just question in general, because it's like how I said, like I usually don't. I usually don't question, but that is information that's good to know, because at the end of the day, it's your time, it's your money, it's your health, which is the most important thing. So why not ask those questions?
In the words of Hilary Duff, why not?
Why not? Why not? Amen.
Well, this wraps up our second episode. I think we're going to get better at this.
I think we are.
We're already getting better.
Once I figure out how to connect my headphones and my mic on time, yep, we're going to be great. We're going to go on tour featuring Fitbull.
Thank you to everybody for tuning in. If you could share this podcast, if you find it interesting, we would definitely love to grow. But the most important thing is we want to share your stories. Mm-hmm. So let it out. Write it into us. We have a Google form, or you could email investigator@gmail.com with your submissions, or you could just DM me, investigator, on Instagram or Facebook. That if you do that, they won't be anonymous. The pro to the form submission is that they will be anonymous. It's up to you, but we look forward to hearing from more of you. We'll
catch you on the flippity flip.
We'll catch you on the flippity flip. If you enjoyed the podcast with us, don't forget to follow us or subscribe on YouTube. Like the video. I don't know how to do I don't know what interactions there are for Spotify or Apple Podcasts. Maybe just share it or listen.
Yeah,
put us on in the background. Oh yes, subscribe to the podcast. Put us on in the background. We're driving to work. We're going to sleep. You don't even have to listen to us. Just put us on. We'll be very grateful.